Hi, my name is Michael White and I'm a doctor of physical therapy. Today I'm going to be reviewing with you simple stretches for your shoulder following a potential traumatic or non-traumatic shoulder injury. I'll now be reviewing what's called a posterior capsule stretch of your shoulder. It's a very simple stretch that doesn't involve any equipment and it can be done pretty much anywhere around your house or even at work. I'm going to demonstrate as if my right shoulder was the affected side. I'm going to take my left hand, reach underneath my right elbow, and simply pull across my body towards my chest. You're going to feel the stretch on the backhand side of your shoulder. You're going to hold for about 30 to 45 seconds and then relax and repeat for approximately 3 to 4 sets. Again, you shouldn't feel any discomfort or any pain during this process. If you do, you can back off on the stretch, or if you feel that the pain increases with the reps, just complete less reps. An exercise that you can perform independently at home without any equipment is simply called repeated hand behind back. I'm going to demonstrate here on my right hand side and I'm going to turn around to show. I'm going to take my right hand, reach behind as if I was reaching for my back pocket, take my opposite hand and grab my wrist, and I'm going to pull towards my left hand side. I'm going to hold that for 30 to 45 seconds, or I can also repeat and do pressure on and pressure off for 10 to 15 reps. You shouldn't feel any pain during this process. And then you always want to check to make sure that your range of motion did not get any worse after that exercises. If you were to have any questions to see if that was appropriate for you, you can always ask your physical therapist. A very simple shoulder stretch that only involves your body and a chair is what I call inferior distraction. Inferior refers to the bottom side of the shoulder or the shoulder capsule. All you're going to do is I'm going to demonstrate on my left hand side is you're going to scoot to the right hand side of the chair, grab the base of the chair, and simply just lean and then come back. It's important to note that you don't want to lead with your head and that you don't want to feel any pain during this process. It's normal to feel a degree of a stretch, but not any acute, sharp pain. And you're going to want to repeat pressure on and pressure off, pressure on and pressure off for approximately 10 to 15 reps. An exercise that's designed to stretch the inferior posterior of the shoulder can be performed while sitting in a chair. All you're going to try and do is reach backwards towards your back pocket. Best landmark is where the bottom of the chair and the back of the chair meet. You're going to then lean forward at about a 45-degree angle, as if you were going to lean over the opposite side of your knee. And you want to think that this exercise should be completed with a pressure on, pressure off count. And pressure on and pressure off. And you're going to want to do about 10 to 15 reps. You shouldn't have any pain during this process. And you always want to recheck the range of motion and make sure it didn't get any worse, or see if your baseline's got any better after you do the stretch. I'm going to be utilizing this stretching strap to complete what's called end range internal rotation of the shoulder. Simplest way to think about it is when you go to try to wash your back, and I'll demonstrate for a better view. All I'm going to start is by placing the strap over my left shoulder. I'll then reach behind with my right hand, grab one of the loops, and simply just pull up with my left hand as if I were trying to bring my hand up my back if I had a really bad itch or I needed to wash my back. I want to try and bring up as far as I can. You can hold this stretch anywhere from 10 to 30 seconds as tolerated, or you can also do it in the pressure on, pressure off manner for 10 or 15 reps. It is important to note that this exercise is very aggressive and should be started with definite guidance from your physical therapist. I'll now be utilizing this cane to demonstrate how to do repeated shoulder extension. Sometimes this exercise is actually the beginning preceptor for reaching behind your back. And some patients can't actually reach that far behind. So I'm going to demonstrate how you're going to do that with a cane. I'm simply going to grab the base of the cane with my right hand, grab the top of the other side of the cane with my left hand, and then simply go backwards. It's important to note that my shoulder should stay in line with my body and that my hand goes straight back and not off to the side. You'll want to perform this in a fashion of pressure on and pressure off for approximately 10 to 15 reps. You're not going to want to feel any pain during this process. Stiffness is okay. And you should also make sure that your range of motion of your shoulder hasn't gotten any worse after the exercise is completed. I'll now be demonstrating a version of shoulder extension that utilizes a cane that's supported by another surface, a door handle, or potentially the inside of a sink. I'm going to pretend that my left-hand side is the affected side. I'm going to start by reaching backwards for the door handle. My palm will be facing up towards the sky. I'll stagger my feet so that I have a nice wide base of support so I don't lose my balance. And all I'm simply going to do is lean forward until I feel a nice gentle stretch in my shoulder, and then come back. Again, you want to complete with the fashion of pressure on, pressure off for about 10 to 15 reps, or you can potentially sustain it for up to 30 seconds. You're always going to want to check your range of motion before and after any of these exercises to make sure you don't lose any exercise. If you've lost range of motion, you might want to consult your physical therapist to make sure that it's appropriate. I'll now demonstrate how to perform external rotation at the 90-90 position. This is designed to stretch the internal rotators of your shoulders and also your pectoralis muscles. I'll start by bringing my shoulders up to about 90 degrees of abduction. My palms will be facing towards my feet, and then I'll simply just bring my palms up towards the sky so the back of my hands can touch the floor. I'm going to hold this position for approximately 30 seconds and then return to the starting position and take a break. I can repeat this exercise for 2 to 3 reps. If you find that it's challenging to return to the starting position, you can simply grab a cane to help facilitate the motion, as I am doing right now. Hold the stretch for again 30 seconds, and then use the unaffected side to bring your hand back towards that starting position. It's important to note that you should always consult your physical therapist to determine if this exercise is appropriate. An exercise that is designed to improve shoulder flexion range of motion starts by positioning yourself in what's called the quadruped position. Your hands will be approximately underneath your shoulders, and your hips and knees will be in line in the 90-90 position. You'll feel equal weight bearing through both hands, and all you're going to imagine is you're sitting back onto your heels with your bottom. This is sometimes referred to as child's pose in yoga. You can repeat the exercise for approximately 10 to 15 reps. Or for a sustained stretch, you can hold for 30 to 45 seconds. It's important to note that you want to make sure that you check your baselines before and after completing the exercise to make sure that you haven't lost any range of motion or a change in your baselines. You should also consult your physical therapist to determine if this is appropriate. An exercise that we can perform while laying supine on a foam roller does involve a little bit of a balance, but it gives you a bigger stretch for your shoulders, particularly your pectoralis muscles. All you're going to do is put your hands down towards the ground with your palms facing up in the 90 position of abduction. Simply relax and sustain the stretch for up to 45 seconds. For a greater stretch, you can hold potentially up to 1 to 2 minutes. You want to make sure that you check your baselines before and after this exercise to determine if it's appropriate, or consult your physical therapist. Thank you for watching our videos today that reviewed shoulder stretching exercises after a traumatic or non-traumatic injury. It's important to note that the exercises should be performed with minimal amount of pain. If you had any questions, you'd want to consult your physical therapist to deem if the exercises are appropriate or not. It is normal to feel a stretch during the exercises, but not any increased pain.